The ICRC response to the conflict in Zamboanga in September 2013 can be broadly described at the moment as having been done in two phases. The first phase was the immediate response during the conflict, an emergency response. Following on from the immediate conflict, we really extended the emergency activities that had already been set up and established a more structured program, shall we say, of humanitarian assistance. We've also been involved in trying to improve the nutritional situation amongst the displaced population through setting up feeding centres in the largest evacuation centres. The programme also caters to pregnant and lactating women. We're also continuing with food distributions, household item distributions, and hygiene kit distributions to really the population that we've identified as the most vulnerable amongst the IDP. There was also a response in terms of protection. We did document what was occurring during the conflict, and we also carried out numerous detention visits, also providing some basic assistance to a number of the people detained in relation to the conflict itself, as well as ensuring that they receive family visits, as well as also, as part of our mandate, discussing with the authorities our findings in terms of the conduct of hostilities, obviously one, as always, in a confidential manner. We are now a year after the conflict, the end of hostilities, and there has not yet been sufficient investment in providing the displaced community with the opportunity to determine their own future, to rebuild their livelihoods, to rebuild their communities. So a lot of the needs that were identified in the immediate aftermath of the conflict still remain very present today. The IDPs continue to live in situations where they have fairly difficult access to water, sanitation conditions in the various evacuation sites and transition sites are fairly poor. Obviously, we want to assist those that are most vulnerable. We will continue to provide food assistance where required. We will continue with nutrition program. We will continue providing clean water, healthcare, sanitation, and these other services. You know, we can't ignore the fact that at the moment there still are very, very significant needs, and those needs will continue to be present until there is a clear direction and concrete steps taken towards a durable solution for the displaced population.